Hi, everyone. My name is Bree Kimberling. I am a nurse here at North Kansas City Hospital. I work in community health and wellness. We have a good presentation today, something that affects everyone. If you own a phone, you might have tech neck, right? So this is Breaking the Curve, How to Combat Tech Neck, and I'm excited to introduce you to Kyle Christopher. Kyle is a graduate from Oklahoma State University with a bachelor's of psychology, and then he went in to obtain his doctorate of physical therapy. Um, where at? From University of St. Mary's in 2021. So, Kyle, you currently work at one of our outpatient rehab clinics, which is Creekwood.
Correct.
You've been at the hospital for a couple of years.
Yep.
Uh,
About two, coming up on three.
yeah. You have a specialty in dry needling. And
Mhm.
tell us a little bit about dry needling real quick.
So dry needling, you probably heard about it. It's kind of one of the new fads that you hear with physical therapy going on. It's kind of like acupuncture, to where you take just a solid needle. You're not injecting anything. It can range from about that big to pretty big. You find where there's muscle soreness or like muscle pain or tightness, and you kind of insert it in and just kind of drive it in, paying mind to all the arteries and nerves, make sure not to hit it. And what it does, it kind of helps relax all those muscles, can even allow you to stretch it a little bit more and help with the pain. I see it as basically a modality, which is our way of saying like ice, heat, and that's a modality basically.
Okay.
So it's not, in my opinion, it's not like you do it just solely that and it'll fix your problem. But if you do it in conjunction with like stretching and strengthening, it works really well.
Okay. Yeah, I've heard of it. And there's a lot of fads around that stuff too. I know a lot of
Yes.
newer treatments. But you also do vestibular training, which is therapy, which is inner ear, right?
Correct. So that deals more. So that is when you got dizziness going on, and there are actually a lot of different forms and causes of dizziness. Probably the most common one you hear about nowadays is something called BPPV, which stands for benign proximal positional vertigo. That's just those crystals in the ear that kind of get out of where they're supposed to be. That happens a lot whenever you lay in bed or get up and the room starts spinning for a little bit of time. That can help treat that. And then there's other conditions to where like one ear is it doesn't work quite as well as the other side for inner ear balance. Or if you hit your head and you got dizziness, then you would come to see me or any other registered vestibular therapist.
Learning some new things today. All right, so we're also going to talk a lot about your neck, like about postures, right? So the more and more time we spend on devices, a lot of us are experiencing neck pain. I know I have some neck pain, shoulders, upper body area. So you're going to help us understand tech neck, hopefully what causes it and how to improve it and manage it. Uh,
Correct.
yeah, and so I don't know about you guys, but are you already like sitting up straighter, like trying to be mindful of your posture right now? So don't worry, like we're all feeling that right now. So feel free to answer. Feel free to ask any questions in the chat or the Q&A, and I'll kind of punt those to Kyle as we go. He kind of wants to just do it kind of laid back like that. So think of some questions, and then I'm excited to hear what you got to say. So take it away, Kyle.
Perfect. All right. Well, this is a pretty big topic among today and probably the coming future because everything we do now seems to be resolved around, or not resolved, revolve around being on your computer, being on your phone. And when that happens, you kind of always like start to lean forward and like really lock into it. You probably see people when you walk around, they're always on their phone and their neck posture is just not the best. So the that can lead to a lot of chronic neck pain. And so that brings us to our topic today. And I will just kind of put aside, I got my dog with me. So if she woofs, that's what's going on. It's not me. Um, but here we go. So breaking the curve, how to combat tech neck. Oh, there we go. Okay, so the outline, this is just kind of like the general what I'm going to hit the topic. So I'm going to go over the anatomy of the cervical spine, the potential causes of it, how to test neck strength, and then I included how to test it yourself, when to see a physician for neck pain and issues. I will actually hit pretty heavy on this because even though this is a very informational thing. Don't take it as a replacement for, getting it checked out if you need to get checked out. And then at the very end, I included a bunch of exercises you can do as well as videos with links to it and kind of how to do them. All right, so hitting the first topic, the anatomy of the cervical spine. So as you can see here, there are these bone things are called vertebrae, and there are 7 of them. T1 is the top of your thoracic spine or middle spine, but what we're talking about is C1 through C7. As you can see, there are these yellow things that are sprouting off to the side. Those are your nerves, but that big yellow thing there, that is your spinal cord. So your nerves sprout out from the spinal cord on every segment here. And that can lead to, if there's some compression going on, that can lead to some of that numbs and tingling sometimes people report. But here's where I want to touch into base here. So on the right side there, you see like the lateral view or side view of the spine there. And between the bones, you probably see those little translucent bluish kind of things. Those are your discs. And what those do is they help support the distance between each vertebrae, because if it was bone on bone, that doesn't feel good. And especially if you get some arthritis in there, that's when you really get some chronic pain going on. But when those discs kind of get really small and get compressed as we age, that's just kind of how it goes. Sometimes those nerves can be a little pinched and cause that referral down one side or even both. All right. So I found this image and I thought it was really a really good visualization of just how much you leaning forward and posture can affect your neck in general. So as you can see, a normal posture here, so standing up relatively straight, it's about 12 pounds of force. I mean, our muscles compensate for that, but even just taking something like an inch or 2 forward, you would almost double, coming up on triple the force that goes through the neck there. And that will just really put a lot of strain on the muscles there, and especially the ligaments. And once ligaments are stretched, there's not really a way to stretch them back. So you really got to make sure those muscles are nice and tight to kind of help with the posture. And then as you can see, once you get to even just 3 inches forward, look at that jump from 2 to 3. It's 10 pounds more. And so that's why it's really important to make sure your posture is pretty good. Even though I mentioned that the ligaments stretch, you can't stretch them back. Here's the thing though, those muscles, they have a great ability to strengthen up and kind of slowly but surely bring your posture back a little bit. Now, if you're at this stage where you're like at 3 inches forward, are you going to be able to probably get to completely normal posture? Maybe not, but you can get something close to maybe 2 inches or an inch forward. But even just as you can see, 1 little inch can make a massive difference there. So what causes tech neck? There are a lot of causes here. One of the most important one is just posture, sitting whenever you're working on your computer or sitting at home, watching TV, or even on your phone. The phone's a big one, honestly. This leads to forward posture, leaning with the head back for too long, slouched, relaxed. We're all guilty of it. Once we sit for long periods of time, we don't really pay attention to how we're sitting. But the most important thing you want to do is just try to sit with your back straight as much as you can, maybe a little back support. You can lean on the back of the chair. Just try not to lean forward really bad. The effects of gravity is also another one. So as you kind of saw from the previous picture, slouching can really, with the gravity in combination with it, can really put a lot of tension on those ligaments in the neck in general. So even just a little bit of slouch, I mean, if you keep doing that for long periods of time, that's going to make your neck pain so much worse. Other faulty positions like pelvic or lumbar spine. The lumbar spine is your low back. So even if you're sitting upright, if you're like really slouching at the hip, kind of where you're sliding back into your chair a little bit, that can also kind of have a, what is the word I'm looking for? Chain effect, cause an effect up the line of your spine. Some other ones are sleeping with the head elevated too high. So the neck position whenever you're sleeping is actually a pretty important topic that not much people think about. So if your pillow is too high or too thick, sometimes it can cause your head to be cranked like that. Or if it's too small or not too thick, your head's like that. You want your head in a nice level position. So it's really important to kind of find the right position there, or pillow height. Now, I know some people aren't side sleepers. Some are on their back. That is, you just want to find something that's comfortable. I wouldn't really recommend laying on your stomach. That's probably a no-go for the neck in general. Poor posture maintained for long periods of time. We kind of talked about that a little bit. And then here's the other thing, the last two that I really want to kind of touch base on. So lack of development of the back muscles back there. So even though the muscles of the neck are pretty important, the muscles in the shoulder blades and even the upper traps here, they're very important. And that kind of leads me to this next little blurb here, the upper cross syndrome. So the upper cross syndrome is a fancy word. We like our fancy words in the medical field. To where there's muscles on either side of the body that when they were weak, the other side will tighten as a compensatory mechanism. When this happens, it can create increased strain on our neck though. So right here it says weak cervical flexors. That's the front of the neck. So these will get weak, but then as you see, it'll kind of cause weakness on the back side here. So that's why it causes that little X there. And then on the top, you get tightness of the suboccipitals and upper traps. So the suboccipitals are the muscles in the base of the neck. Those can be common for headaches if they're tight. And then the upper trap are like those, that shoulder stuff that you feel right on the side of your neck. You got on each side, and then tight pectorals. Those are your chest muscles. So if those two are tight, but then you got weakness on the crisscross opposite side, that can really cause increased tension and pulling forward of the head and then causing that stretching of the ligaments back there. So what is it specifically, definition-wise? So upper cross syndrome is defined as altered muscle activation and movement patterns of the head, neck, shoulders, and back muscles. Tightness and weakness are in a cross pattern. So basically, the pectoral muscles get tight and contract, resulting in pulling of the postural muscles that help you to sit up nice and straight. But if they're going to constantly be pulled like that, it's going to cause an effect on the neck because they help support the neck. So if they start to get weaker, then your already base of support for the neck is already impaired. That's why it's so important to make sure the muscles back there are just as strong as the muscles in the neck. So how to test this actual neck strength? There are two forms of it, the deep cervical flexor endurance test and the cervical extensor endurance test. I'll be honest, the only one I primarily use is the first one, the deep neck cervical endurance test. But I did a little research and I found there's an extensor one. But as far as neck stability, the neck flexors, the ones here in the front here, are the most important. All right, so for the first one, the one that I use a lot, the deep neck flexor endurance test. So this is to assess the strength of the deep neck flexors. And they have found that the weaker these are, the less stable your neck is. And that can cause increased compression or weight to go through the neck. So normative values are about, I typically in the clinic always just go 60 seconds flat for female and male, regardless of gender. But as far as actual values that I found through research, the male value is about 55.5 seconds, and then the female value for average, these are averages here to what is considered good, it would be 45.2 seconds. But like I said, I like to shoot for the 60 seconds, and that's basically where you're laying on your back, you lift your head off the table, and you try to hold it for 60 seconds, but without letting your head hit back onto the table because it's too tired or too fatiguing. So the way how you can test that yourself, I included a little link here. I will say all these links, they're not really associated with the hospital. They're people I found through YouTube. So take they're not entirely associated with us, but I found they were very helpful.
And Kyle, I'll throw those in the chat. And if you guys want to click and save those, you can do that through the chat. Okay.
Perfect. And so the next one here, the cervical endurance extensor endurance test, that is the muscles in the back of your neck. So they help you extend the neck. That's why they're extensors there. So this is basically, it can contribute to neck complaints and just the same with the cervical flexors. The normal values for this is about 47 seconds for males, about 40 seconds for females. I, again, would probably go for about 60-second holds here as the time I would try it. I have not personally done this one, but I think it would be a very good resource to try it. If you're really good on one side, but then you want to see if the other side's any worse, then you may be weaker on the extensors than the flexors. So this is where I really kind of jump in to be really give my 2 cents on. So, when to seek medical professional help for your neck pain. What I like to say is we have a thing that we're taught in school. They're called the 5 Ds and 3 Ns. So if you have any of these, then you definitely want to go just get checked up with a physician or orthopedic surgeon, one of the two. So it's dizziness. So it's like room spinning, or you just feeling, everyone knows kind of what dizziness is. Diplopia, though, that's double vision or blurred vision. This is in combination with neck pain. If you're having it without neck pain, I wouldn't, get it checked. But all these are in conjunction with neck pain. So drop attacks is sudden loss of consciousness, so fainting, basically. Dysarthria is difficulty saying words or pronunciating them, not difficulty finding the right words in your head, but trying to speak them. Dysphagia, that's trouble swallowing or unexplained hoarseness. So if you're trying to eat and you can't really swallow your food and you've been having a lot of neck pain, probably want to get it checked out. Nystagmus. So this one you don't really hear too often of. This kind of is in my realm of vertigo and just dizziness treating, vestibular training. So nystagmus is when the eye starts to kind of fluctuate back and forth, to where this can really happen if the way people explain it is it feels like the world is shaking a little bit. Nausea or vomiting with severe neck pain, that's a pretty big tell to go to emergency room. And numbness and tingling, particularly in the face or extremities. So when I talked about the nerves a little while back, if you have compression of one of those nerves, it can cause numbness and tingling down the arms, even into the face. Most of the time, this is okay, but on the small chance if it's not, then you really want to get checked out to make sure you don't have compression on the spinal cord going on. If any luck, it's just compression of one of the nerve roots, and then we can help treat that in the clinic here. But you want to make sure that's all that's going on before you come to see us. So other red flags is constant progressive non-mechanical pain. So no relief with bed rest, prolonged use of corticosteroids. Long-term use of corticosteroids can have been linked to osteoporosis, especially in females who are very up there in age, because y'all are just more prone to osteoporosis because when you get older, estrogen starts to kind of deteriorate, and that's needed for it. So be a little wary of that if you get a lot of neck pain and you've been on corticosteroids for many years. And that's, I believe, like prednisone and stuff like that. Unexplained weight loss, fever and night chills, battering bowel disturbance. Most of the time that's more lumbar back pain, low back pain. But if you get it with the neck pain, yeah, get that checked out for sure. Recent history of violent trauma, that includes being in a car wreck or you fall on ice recently and kind of hit your head, and then widespread neurological symptoms. So that explains like a lot of numbness and tingling in the fingers, you're getting in the feet, and you're just having like a bunch of weird twitching, a lot of weird symptoms. That's kind of what it is. All right. Excuse me. So now time for the part that everyone really looks for. Most of y'all know here, y'all have issues with the neck. Now you're wondering, okay, I get it. It's neck pain happens, but how can I fix it? Well, here are the exercises. I compiled 10. A lot of these are stretching and some are strengthening going on. You need a good mixture between the two. I'm a big fan of you want to do half strengthening, half stretching. If you do all of one, very rarely is that going to help you out in the long term. The thing I tell all my patients, though, is I hate the phrase no pain, no gain. I wish that never really came into physical therapy. I'm a fan of, with the stretching, you get a stretching sensation. And with the strengthening exercise, you get like a muscle burn, muscle fatigue, like you're working the muscles. But if you start to get an increase in sharp pain, or if you get sharp pain at all, or an increase in radicular symptoms or numbness and tingling down the arms, or it just doesn't feel good, nausea or vomiting or anything like that, do not push into it. Do not. That is one of the times no pain, no gain is not really necessary.
Kyle,
So,
we have a question. I have a question for you.
Perfect. So what?
Barry, did you have a question for us? Just need to unmute.
No, maybe it got hit accidentally. I don't know.
Okay, no worries. I do have another question while I have you though, Kyle.
Yeah.
What do you have a recommendation for ergonomic chairs?
Specifically, no, but there are, if you just look up like proper ergonomic setup for like online on Google, there's actually a lot of good PDF forms that show like how you want your feet and like hands and the neck posture for the most part. Any chair you can kind of modify to what you want it. I wouldn't go super crazy and break the bank on like the top of the line ergonomic chair going on, because even if you have it, you still got to modify it to your body specifically, because everyone's got a different body. Some are really tall and lanky like me, and then some are a little bit shorter and maybe just need a little wider arm length going on. So the way to kind of do it is just look up proper ergonomics setup on Google, like PDF, and it'll show you. I know one of the things they want you to do is with your arms bent, like at 90 degrees, they should comfortably rest on the desk. You should have comfortable back support, not to where you're leaning back a whole lot, but sitting nice and straight. Your knees should be, your hips when they're are at 90 degrees and your knees at 90 degrees should be pretty level. So you want things, and then the eye, where you want your eyes, you want the computer to be about like eye level. So sometimes there's little supports for your computer that you can sit to where it's very elevated up. There's a lot of good resources out there, and then I can probably find a PDF that I prefer to kind of explain and help set it up, and we can probably attach it in some way.
Yeah, everybody will get a copy of Kyle's PowerPoint. I'll email whatever email you registered with, and so we can include it in that, Kyle. Sound good?
Sounds good.
Okay. Carry on, friend.
All righty. So the first exercise, doorway pectoral stretch. So this is going to really stretch the muscles in the front and the chest going on. Kind of remember how I talked about upper cross syndrome? These get really tight. And so the way to stretch them is to basically find a doorway, put your arms on either side, and just lightly kind of lean forward into it. So as I kind of put here, you want to hold a stretch for 30 to 60 seconds. This is where a lot of people get confused. It's whenever a lot of people think if they hold a stretch for 10 seconds, that's good enough. There's actually been research indicated that if you don't hold a stretch for minimum 30 seconds, it's actually not going to stretch the muscle for long periods of time. So you can hold it as long as you want, up to 60 seconds, heck, even like 2 minutes if you want. I mean, anything over 60 seconds is overkill, but you got to hold it at least for 30 seconds, and that'll result in the most long-term changes of that muscle tightness and pain you got going on. Right, and so the bilateral rows here. So this is a strengthening exercises. What it does is it hits the muscles between your shoulder blades. Those muscles are really important to help stabilize the neck. The stronger those are, the more it's going to help with your posture, bringing the shoulders back, and then also help out the upper traps, which are up here. So the stronger those are, trust me, these make the most difference. Now, you can go to like any kind of Walmart, Target, or anything like that and get the TheraBand. All you kind of do is you just wrap it around a doorknob, and then on the other side and close the door, so that way it won't move and pop you in the face. And there's also links on all these. But what I like to say is when you do this, try not to hike your shoulders up. A lot of people do that. So that is just feeding into the upper trap strategy. You want to keep the shoulders nice and low, and then when you pull the shoulders back, try to squeeze them together like you're trying to squeeze and hold a pencil back there. And then you just kind of do the same thing, multiple reps. So the straight arm pull downs, these are kind of like lat pull downs, but I prefer these a little bit more. So your arms will be kind of straight out, and then you're just going to pull them straight down. These hit more the lats area and a little bit of the rhomboids also. And same thing, you want to make sure your shoulders are not hiking up. You can do this one and the other one in a chair, but I prefer it standing. But if you have trouble with balance, you can do it totally in sitting. I want you to be safe and not have an accidental fall going on. Right, the chin tuck. So this is where we really get into the actual strengthening for the neck. So the chin tucks help strengthen the deep neck cervical flexors. These are the ones that are weak whenever you can't do like the deep neck cervical flexor endurance test we talked about earlier. It's kind of hard to do this, as you can see. I incorporated a lot of things, a lot of nice picture here and then a couple little sentences here. So the way to do it is this way. The way I like to explain it is, you know how some people bob for apples to where they take their neck nice and far, but then when they bring it back, I want to focus on the bringing it back portion. So the way you can kind of do it is hold your hand right here, and then you just try to move your neck backwards away from it, and then bring it back. So as you can see, it's not the most attractive of exercises. It causes a double chin, but that is actually how I want you to do it. If you feel the muscles kind of working here a little bit, you may feel a little stretch in the back of the neck. You're doing it right. This may take a little bit of work and practice to get to it, but that's why we included the links here. These exercises are kind of my bread and butter for really strengthening the muscles between the shoulder blades to help the neck out a lot. So you can do these on your stomach or on your hands and knees. I know not everyone can on their hands and knees, and not everyone can do it laying down. So if you got to just kind of lean over or kind of hold on to a table and lean over a little bit and try these exercises, that is totally fine too. They call them I's, Y's, and T's based on the direction of your arms. So I's are whenever your arm's going straight up, Y's are going out to the side diagonally, and then T's are, straight out to the side completely. And then the last one on the bottom left here, that's actually a W, and that is where both arms are like this, and you kind of raise them up, kind of like, whoa, I'm innocent, don't do anything. And here's the next one. Now a couple of the stretches going on. So the upper trap stretch. This one I can actually show you in the video here. So like I said before, any stretch you want to hold for a minimum of 30 seconds. But the way to do this is you'll sit kind of relaxed posture. You'll take one hand, put it on the side of your head, and you're going to gently pull straight to the side. Try not to turn your head. Keep it looking forward and just pull straight to the side where you feel a nice stretch there. Again, if you're doing this and you get numbs and tingling, don't do it. Back off of it. Now you can do it just a little bit to where you get a stretch, and that's fine. Just count to 30. And then what you'll do is you'll do the same thing for the other side. And the other one is the levator scap stretch. It's similar, but it hits a different muscle. So what you do is, the way I like to explain it to patients, it's almost like you're trying to check if you got deodorant on. You'll look towards your right armpit, put your hand on top of your head, and just kind of lightly pull down. And you should feel a little bit of stretch maybe from the neck all the way to kind of the top of your shoulder blade. Same kind of thing. You want to hold it for 30 to 60 seconds. Now, if you have a lot of trouble with these stretches, sometimes what you can do is put a little hot pack on, get those muscles relaxed, or even take a nice hot shower and then try the stretches and see if that makes it a little better, if you can stretch it a little bit more. There is such a thing as too much stretching. So what I like to tell people is, whenever you stretch, maybe do like 2 sets of 3 or like 6 of these max a day. You don't want to do it like 15 times a day. If you stretch it too much, that can really make those muscles irritated. All right, and then the next one, same kind of thing. You can get a TheraBand at any kind of store or Amazon. Amazon's got everything nowadays. Oh, sorry. There we go. And basically, you kind of put it around the doorknob on the other side, close it, or you can go to a gym. All this is, you're taking your arms and just kind of spreading them apart, really trying to squeeze the shoulder blades together and coming back. Those really hit those muscles between the shoulder blade. The next one, these are getting back into the neck cervical strengthening going on. Ideally, I would want you to have your head on a pillow here. I couldn't find a picture of it, sorry. But at home, you can do this on your bed, pillow there. All you're doing is you're gonna lay down with your head on the pillow like so, and you're gonna turn your head as far as you can and back down. You'll do kind of what I tell people is about 3 sets of 10. Take it to where you get a nice, good little muscle burn, but don't take it to where you get a sharp pain going on. If you start to get a sharp pain when you go too far forward, just kind of take it just shy of it. Don't go into it. River. Front and sideline side bending. So this is the same thing. You're going to be on your side, head on the pillow, and all you're doing is just kind of raising the head off the pillow and back down. This works a different muscle. You should feel it on the side here. Now, there is something you can do with these last 2 exercises. You can combine them. If those 2 are super easy, you can combine them to where you lift your head up and then you turn. That's a little harder, but I want you to try them both separately before you try that. And then finally, here are references. I included them in MLA format with the links to them in case you wanted to see the actual scientific literature or anything on it.
You guys all do the workout? My neck feels nice right now. I'm just saying, the stretches are good. You do have a couple questions. Cami said,
Perfect.
thoughts on what to do with poor posture with daily prolonged computer use, which I think a lot of us have, right? Sitting at a desk. This is causing headaches, pain primarily on the right side, sometimes on the left, and sometimes in the back of the head. So sitting at a computer, headaches, pretty much neck and head pain.
So that does make sense. There is something I didn't touch on it here, so I'm glad they asked that question. That's a very good question. You can sometimes get headaches from neck pain. That is something called cervicogenic headache. It's where the headaches come from the neck, and the way it kind of feels like is the headache will feel on the back of the head and sometimes on the top of the head. So to kind of help address that, you want to do some of these exercises here and maybe do some of the heat prior to the stretches and then the strengthening exercises afterwards. Really work on those shoulder scap protractions, like the bilateral rows. Make sure the muscles between the neck or between the shoulder blades are really strong, because a lot of times we're super weak in those, and that is why, and tighten the shoulder muscle and the pectoral muscles. That's why our shoulders are very hunched over. So you want to stretch these front ones and strengthen the back ones to kind of help the posture and help out the upper calf and the neck going on. Now, I will say if the headaches don't get better after doing them for like a week or two, probably get it checked out.
Right, go see your physician. Okay, mentioned sleeping on the stomach, and this person is a stomach sleeper. Any tips or pillow recommendations to not sleep on stomach?
I do know, so there are some pillows that have like kind of like that hole in the middle. So if you really do sleep in your stomach, sometimes you can find that pillow to where it's got the hole on. I know once you find a certain position you like to fall asleep in, it's hard to change it. So there are those pillows that kind of, halo effect, and you can sleep on your stomach that way. As far as other pillows to kind of do, I prefer like those memory foam pillows you can add and take out of it. So that way you don't have to constantly buy a new pillow. That way, like the one I have, it came with a whole separate thing of foam that I can add if I wanted it thicker or a little smaller, and that way you can play around with it.
And the thing is, when you're sleeping, often you just wake up and you're in that position, right? It becomes such a habit.
Yeah.
Yeah. Training takes a long time. Okay, do you have insights about over-the-counter products for neck and shoulder pain like Iron Neck or TENS units?
Yes. So Iron Neck, that's been a long time since I heard that one. I'll touch on the TENS unit first. So TENS units are pretty much just to help with this, stimulate the superficial nerves of the neck. So they're not hitting like those like deep down there. They're just kind of hit the nerves close to the skin, and they can help provide pain relief. They're good for basically getting your mind off the pain for a little bit. Sometimes it can last for an hour or two. And so if it's just really bad, I think it's fine. But if you're getting a lot of numbs and tingling, do not do the electrical stimulation. That's actually a contraindication, which is a huge no-go. If you have numbs and tingling going on, definitely go see someone first before you even try to do that TENS unit. Because if you can't feel anything, then you're not going to be able to feel how much electricity is actually being applied to your skin. And that can be a big problem for like electrical burns or stuff like that. The Iron Neck, oh man, you don't hear too much of that one anymore.
Tell us what Iron Neck is. I'm not familiar with that.
I'm trying to think if it's like that cervical traction unit, which is where they'll have to correct me if I'm wrong, to where basically you put your neck and this little contraption that kind of helps stretch your neck out. I'm just trying to go off my memory here. So if that's not correct.
I just Googled it. It kind of looks like a halo that goes around the top of your head. And then it's got a cord, it looks like a bungee type thing that you would exercise with.
So that's the weighted halo. That's for the exercises. I remember now. Yeah, you don't see too much of that. That is fine. I would say do some of the exercises without the iron neck first, get it nice and strong, and then maybe try it. Actually, some people, when it, like those cervical rotations or side bending, laying down, do that without it, and then you can actually put the iron neck on it and then do it with it if you want to strengthen it more. There is another modality that I think would be, that someone didn't mention, that would be pretty good. If you have like a pinched nerve, or if you have a lot of neck pain going on, sometimes something called a traction unit, which is where it kind of helps to stretch, pull your head a little bit, decompress the neck. There are some things on Amazon where it's like a water bag. It kind of, you sit next to a door, you hang it over the door, and it just kind of lightly pulls up. That is sometimes worth it. Or if you're lucky enough to have a partner, sometimes you can lay on your back, they kind of grab your head and just pull it a little bit to see if it feels good or not.
Hey, any tips for let's redo that. Any tips for retraining yourself not to slouch and lean forward while you're sitting at a computer all day?
That is a very good question. I know there are some postural braces that help you with that a little bit. I have a love-hate relationship with those because I think they're very good to kind of help you kind of remind but some people over rely on them too much. So if you just do it for like maybe a couple times a day, an hour or two, something like that, I think that's fine. But you don't want to wear it all day, because then your muscles, they get used to that extra support, and that can actually make it worse. So another way you can do it is maybe just like set an alarm on your phone like every hour, to where once it goes off, you just kind of take a little self-assessment going on. How am I sitting? Or if you put like a mirror to the side, and then you can kind of look at it to see, are you slouching a whole lot? Stuff like that.
Yeah, so there's a lot of contractions is what I'm gathering.
Yeah.
I think probably one of your best bets is everyone's unique, right? Everyone's situation and symptoms are different. Seeing your physician, going and seeing a physical therapist, i.e. Kyle. So how do we find you, Kyle? Do we need a physician's order to see a physical therapist?
As of recently, no. They just recently passed the direct care access for physical therapists in Missouri. It was present in Kansas, but they just passed in Missouri. So you can go to any physical therapist, not just our location, but any physical therapist in Missouri, to where you can see them for up to 30 days before you have to get a physician referral for anything more.
And insurance covers that usually?
Most of the time, yes, but you want to make sure what your insurance is prior to going in. Because I know, here's the thing with insurance nowadays, we all got our quips with it. If you're on a high deductible plan, you definitely want to make sure your insurance covers it, because the reason why the high deductible plans are so cheap is because they're built for the people that don't plan on going in very often. So whenever you do need it, you're actually having to pay like a lot of money whenever you do go to a physician's office. So anytime you plan to go to a physician or a specialist or any kind of physical therapy, just give them a call, give them your insurance, and be like, hey, am I covered? And they'll check for you. That's no problem. And they'll let you know.
And we have multiple locations. We have an outpatient clinic at the actual hospital. We have Creekwood. What's the other location, Kyle?
North Oak.
There's one on North Oak. So multiple options. You can always get on our website. We'll include this information in the email that we're going to send out after the presentation as well. But I love a good PTOT speech therapist. I always learn so much from you guys whenever I've had consults with you all. I think you just take so much time into like listening to the symptoms. You know anatomy so well. So if you guys have never seen a therapist, a physical therapist, OT, occupational therapist, highly recommend. 5 stars. I'll say that. Does anybody have any more questions? You guys had really good questions, and I appreciate the interaction. I know Kyle probably does too. While we're waiting to see if we have any more, like I said, if you registered for this class, you're going to get an email from me, with Kyle's info, the PowerPoint, and maybe some information he wanted to attach.
Yeah.
Please go to our YouTube channel. So it's North Kansas City Hospital YouTube channel. We have hundreds of videos there about a plethora of topics, whether it's therapy, pain, nutrition, speech therapy. We have tons of info. So please go check that out. You'll find something I'm sure you like there. And always check back on our website for more classes coming up, like you guys did when you registered for this. So go back to nkch.org, classes and events. Check it out. See if you like something. Yeah, got some thank yous up there. Physical therapy is amazing. Thank you for having this available. This is such a great webinar. Thank you for sharing with everyone. And I thank you too. Thank you guys for joining us. Thanks, Kyle Christopher, for
Thank
giving us your
you.
knowledge. I hope everybody's sitting up straight today, stretching your necks out, being mindful, okay? And have a good one. We'll see you next time.
All right. Thank y'all.
Bye.